What's up guys, welcome back to my channel. Today we're going to be talking about everything ketamine. There seems to be a lot of interest in ketamine from people who give it and people who receive. So I thought I would just make a video about everything I know about ketamine. I'm going to be talking about what it is, how it works, how do you give it, what are the pros and cons, what are things that you need to know about it before you're giving it, should you be diluting, what are the dosages, what do you want to avoid. That's everything we're going to be discussing in this video. So let's talk about what is ketamine. So ketamine is a analgesic dissociative. So pretty much what that means is that it disassociates your brain from your body at the level of the spinal cord. That's where the receptors are. The MDMA receptors are at the level of the spinal cord. And so whatever happens to the body is separated to what happens in the brain. It's very powerful. Really good things about ketamine, and the reason why it's so popular in the pre-hospital setting and in the hospital setting is that its onset of action is super quick. So you can give this medication and within a minute you will have the response that you're wanting. How can you give it? So you can give it IV, you can give it IM, you can give it intranasally, you can give it IO. So you can give it in many ways, but the dosages slightly differ. Something I learned that's very interesting is that the bioavailability, which is how much of the drug is available once it's been given, which is obviously 100% when it's given IV, is that it is 93% bioavailability when it is given IM. So the drug is actually super effective intramuscular. So the dose range that we're kind of looking at and what I've used is that depending on how much you give, you get a different kind of response. So if you want to sedate someone, just give them sedation. You're going to give them 1 milligram per kilogram. So let's say I'm an 80 kilogram male. You're going to give me 80 milligrams of ketamine, IV, and that will sedate me. If you want to induce me or completely disassociate me, so I feel nothing and don't move or anything like that, you're going to give me 2 milligrams per kilogram. And then if you just want to deal with pain, you only want to manage someone's pain, you're going to give them 0.1 milligrams per kilogram. So you'd give me 8 milligrams IV. And I'll have no pain. Stay tuned till the end and I'll tell you about a story of a child who I gave ketamine to and what the response was. The other huge benefits of ketamine is that it maintains airway reflexes, it maintains breathing and the respiratory drive, which is unique to anesthetics, and it also increases blood pressure and heart rate due to a release of catecholamines, and then furthermore it has a mild bronchial dilation. So if we're dealing with asthma, ketamine can actually be effective, or it would be the drug of choice for induction for an RSI when it comes to patients with asthma, even though we don't want to be RSIing patients in asthma. Here's a video about that. So what are the cons? Because I've been talking about a lot of the pros. The cons of ketamine is that there is this thing that can happen where patients kind of lose control, so they become uncooperative when you give them ketamine, or they can have really bad hallucinations. So there's a lot of people who have had like PTSD, or they have other mental issues or mental disturbances due to receiving ketamine because of the hallucination side effects. It's actually a very unpopular drug in drug users because of these negative hallucinations and for that kind of issue. So there are multiple ways to avoid negative hallucinations. The one is that if the patient is in a good state of mind when they are given ketamine, they're more likely to have a good hallucination or a good experience with the drug. So when people use ketamine for recreational purposes, they control their environment because they know that the mindset that they go into using the drug is kind of the experience that they're more likely to have when they're using the drug. So they will turn off the lights, they will turn off their phones, they will control who's there and what's happening so that they are guaranteed to have a positive experience. So when we're giving ketamine to someone who's had their leg chopped off, or they've been hit by a car, or they've lost a loved one, and they're in a very negative state of mind, you can obviously imagine them going into a really bad hallucination because they're in pain and they're anxious and they're full of adrenaline and all sorts of other things are going on in their bodies that this isn't conducive to a positive hallucination. The other thing is that we can get them out of this uncontrolled combative state, because what happens is that there's a dose range you want to avoid so that the patient doesn't go into this uncombative state where they are having a hallucination but they're awake. You cannot have a hallucination if you are asleep. So you either need to knock them out and make them unconscious with ketamine, or you need to stay away from that state where they're going to be kind of where they are they kind of become like a gorilla and they don't cooperate and they pull away. I've had someone trying to like sit up from being on a spine board because he wanted to get up and go. And he's very strong and you just can't communicate with them and they're just doing their own thing. So they kind of become this uncombative state in the club dose. So the way you fix this is that you give more ketamine. Ketamine has a very safe profile. They've done studies where they've given 4 milligrams per kilogram and there's been no negative side effects. And by no means am I saying you should just give more ketamine all the time, but to know that if you give like 1 milligram per kilogram of ketamine and now they're in this club dosed state, you can very, very comfortably give another milligram per kilogram of ketamine and they're gonna be okay, which is really good to know. So another way to avoid this, or another way to help with these hallucinations, is to give a benzodiazepine. So if you give someone 1 milligram, 2 milligrams of midazolam, you are going to calm them down. You're going to get rid of all that anxiety. You're going to put them into a much better state. So even if you give them the 1 milligram with the ketamine, or you give it before the ketamine or after the ketamine, it's going to help them calm and relax. This also helps when they wake up, and if they are having a re-emergence and they're waking up and they're freaking out, you can give them 1 to 2 milligrams of midazolam. The other benefit of giving midazolam is that there's that amnesia part where they actually forget all that negative stuff that they saw. So rather than them having to go to like a psychologist and dealing with the things they saw because of ketamine, you could just give them some midazolam and that would also reduce the chances of that. The other thing that are the cons, or the things that you need to try and avoid, is that if you give undiluted ketamine very quickly, you can cause apnea. And so the problem with that is that, well, one, we don't want patients to have apnea, but the other is that if you are performing a RSI and you give a massive dose of ketamine, let's say 200-300 milligrams IV push, like rapid push, you could potentially stop their breathing for a short period of time. And the issue with that is that then you might think the patient is paralyzed, or it will impact on your pre-oxygenation because obviously now they're not breathing before you were planning on them not breathing. So that's going to kind of get into that. So if we dilute it and we just give it a little bit slower, we're going to avoid the apnea. We're going to probably have better hallucinations and a lesser chance of negative hallucinations if you don't give it rapid push. And those are kind of the things that you want to look out for. The other thing that can happen when you give ketamine is that you can have this hypersecretion out of the airway. So just this like bubbling of foam out of the airway. I've never seen it. I've heard about it. I've read about it. And so the way that you're going to deal with this or fix this is that you're just going to give a dose of atropine, because the atropine will dry up all of that hypersecretion and it will go away. I've never seen it, thankfully. So ketamine is safe to give in head injuries. Ketamine is safe to give in patients who are having an MI. So if you're going to have to pace a patient or cardiovert a patient who's having an MI, ketamine is not ruled out. We used to be like, no, can't use ketamine because it's going to increase their blood pressure and kill them. It's not what's going to happen, because it doesn't directly increase blood pressure. It only releases catecholamines, which then indirectly increase heart rate and blood pressure. So it's not actually going to increase the workload of the heart if the heart is already working. And the same thing with intracranial bleeds or isolated head injury. We are actually giving ketamine to these patients. It is safe, it is effective. So I believe that is all that I've probably missed something. So if I have missed something or I forgot to add something, I'd love for you guys to add to the bottom. I'm sure there's a wealth of knowledge out there. I'm sure you have lots to say. I'd love to read through your comments and get back to you. I'm sure we can all learn together. So guys, thank you for your time. If you did enjoy this, please hit like and subscribe. And if you are interested in these sort of topics, you should really check this out because this was game changing.